So I'll talk about flail chest today. I'll give you a scenario. So we have a sports car that is running at a very high speed. Unfortunately, it's a pedestrian. So this pedestrian took a massive blow to the chest and he falls onto the ground. People from the surrounding called an ambulance. The ambulance, the ambulance came and picked up this individual. It is going to reach the emergency department. So you are from the emergency department and you had gone for a 5 minute break, 5 minute tea break, and you get a call from the ER and you immediately rush to the emergency department, right? And there they are briefing you about this case. A 24-year-old male presented to the ER with history of RTA, four-wheeler, and he suffered a major injury to the chest, right? Patient complains of pain in the chest and he has respiratory distress. So vitals you can see, pulse rate is high, BP is low, respiratory rate is high, saturation is low. On ABG, the PaO2 is also low. It is 60 mmHg. And coming to the examination part, on inspection, you can see the patient is having paradoxical breathing. This becomes very important. This is a very important observation. And on palpation, chest compression test is positive. On auscultation, you can see the breath sounds are decreased, right? So you come to a conclusion based on these findings. This patient has flail chest. This patient has flail chest, right? So what is flail chest? It is nothing but fracture of three or more ribs at two or more different places. As you can see from this image, let me take this as rib 1, rib 2, rib 3. So fracture should involve three ribs, right? 1, 2, 3. Or it could be more than three also. At what two or more different places. So if you take this rib, this patient had suffered fracture in the same rib at two different places. It could be more than two different places also, but definitely the fracture has to be at two different places in the same rib, right? In the same rib. So this is what they mean by flail chest. So patient suffered a blunt force trauma. In the normal rib fracture, you can see the fracture site is only at one place. Whereas if you want to term the rib fracture as flail chest, you need to have fractures at three different ribs. Fracture is present here, here, here. So what is the other requirement? Fracture has to be at two or more different sites. You can see in this case, fracture is present at two different sites. So this becomes flail chest. This flail chest is deadly. This flail chest is deadly. So what is the consequence when patient suffers from flail chest? For that, we need to understand basic physiology, basic anatomy and physiology. I've explained to you in the previous video how external intercostal muscle helps with inspiration, right? So here you can see, I'll explain it again briefly. This is medial, this is lateral side. You can see this is sternum. So this is one rib, this is another rib. The space between one rib and another rib, the space is intercostal space, and three muscle group occupies this intercostal space. So the muscle group is called as intercostal muscles. So from out to in, these muscles are arranged in this manner. First one is external intercostal, second is internal intercostal, and the third one is innermost intercostal. So we are going to study only about this external intercostal muscle, which brings about inspiration, right? So the origin point of external intercostal is this one, and the insertion is on the lower rib. Right? So whenever this external intercostal contracts, it contracts from insertion to origin, right? So whenever external intercostal contracts, it lifts up the thoracic cage like this. It brings about two different movements, which is very important for us to understand. The first movement is bucket handle movement. Bucket handle movement. So in this image, you can see this is the original position. This is the original position of the ribs, which are slightly slanted like this, slanted down like this. So when external intercostal contracts, it is going to lift up the thoracic cage in the outward direction like this. As you can see, when external intercostal contracts, this original position, it has eventually gone up like this. This is the final position. This is the original position, and this is the final position. Because of this action, horizontal diameter of the thoracic cavity volume increases, right? Volume increases. So it increases the horizontal diameter volume of the thoracic cavity. So this is compared with the bucket handle movement. We can see this is the initial position. And because of the contraction of the external intercostal muscle, the rib cage moves upwards like this, upwards and outwards. So this is the final position. This is the final position. So the second important movement is pump handle movement. So pump handle movement, right? Pump handle movement. So in this image, you can see, so this is the initial position of the rib. This is the initial position of the rib. This is sternum. This is vertebra, right? The ribs are attached from sternum to vertebra. So this is the initial position. When external intercostal muscle contracts, it is going to push. When it lifts up like this, it is going to push the sternum forwards. So sternum, the initial position of sternum is here, and you can see after the contraction of external intercostal muscle, it has moved, the sternum has moved forward. Thereby, it increases anteroposterior diameter of the thoracic cage. Anteroposterior diameter of the thoracic cage. So this is the thoracic cavity. Because of this movement, it increases the anteroposterior diameter of the thoracic cavity. Thereby, it increases the thoracic cavity volume. So this is compared to the pump handle. This is the initial position of the sternum, and because of the contraction of the external intercostal, it slightly moves forward like this. Thereby, it increases anteroposterior diameter. So by these two movements, basically it increases the thoracic cavity volume. Thoracic cavity volume. We have seen in the previous video, volume is inversely proportional to pressure. This is Boyle's law. This is Boyle's law. So when volume increases, pressure here in the thoracic cavity decreases, right? Pressure in the thoracic cavity decreases. So this decrease in pressure in the thoracic cavity makes the pressure in the thoracic cavity negative, right? The thorax makes the pressure in the thoracic cavity negative. Air from the atmosphere can enter the thoracic cavity, and ultimately it reaches the alveoli, right? This is the normal anatomy and physiology. So what happens when patient suffers from flail chest? We need to understand two important things. The first one is paradoxical movement, and the second important thing is pulmonary contusion. So I'll explain paradoxical movement first. Paradoxical movement, right? So this is vertebra, this is sternum, this is anterior, this is posterior. So the ribs are attached from sternum to vertebra, right? Sternum to vertebra. This is just a schematic diagram. So this is rib number 1. This is rib number 2. This is rib number 3. So they're in front, they're attached to sternum, and at the back, they're attached to vertebra. And in between these two ribs, we have intercostal space, and this space is occupied by intercostal muscle, and especially external intercostal muscle helps with inspiration. So this patient suffers from flail chest. So I can see fracture is present in rib number 1, rib number 2, and in rib number 3. And to call it as a flail chest, you need to have fracture at two different sites. So this is fracture number 1, fracture number 2 in the same rib. Similarly, fracture site number 1, fracture site number 2, and same here also, right? So we can easily call this as a flail chest. So as I have explained earlier, when external intercostal contracts, thoracic cavity volume increases, thereby it brings about negative pressure inside the thoracic cavity, negative pressure inside the thoracic cavity. And because of this negative pressure, air from the atmosphere enters the thoracic cavity. So this negative pressure is very important for us to get the air from the atmosphere into the thoracic cavity. So during inspiration, the thoracic cavity moves outwards, right? But this flail segment is neither attached to sternum in the front nor attached to the vertebrae at the back. It is freely floating. It is freely floating, right? And during inspiration, because of the negative pressure that is created inside the thoracic cavity, as it pulls the air from the atmosphere into the thoracic cavity, since there is no attachment to this flail segment, this moves inwards during inspiration. Whereas the rest of the thoracic cavity moves outwards, this flail segment, because of this negative pressure, it gets pulled inside. It gets pulled inside. So this flail segment from its initial position, because of this negative pressure, gets pulled inside during inspiration. Whereas the rest of the thoracic cavity moves outwards. So what happens during expiration? So air from inside the lungs exits and reaches the atmosphere, right? So pressure in the lungs has to be high. So I've explained this in detail in the previous video. So I'll explain it briefly here. So this happens, the expiration process is a passive process. This happens because of the relaxation of the diaphragm, and because of the elastic recoiling property of the lungs, they go back to the normal position. So ultimately, what happens because of expiration, the thoracic cavity volume, the thoracic cavity volume decreases decreases. So when thoracic cavity volume decreases, pressure will increase, right? Pressure will increase. So this positive pressure that gets created, this positive pressure that gets created inside the thoracic cavity pushes the air from the thoracic cavity into the atmosphere. So because of this positive pressure that gets created inside the thoracic cavity, this flail segment gets pushed away by this positive pressure and it moves outwards. It moves outwards, right? This flail segment gets pushed by this positive pressure and it moves outwards. It moves outwards like this. Whereas the rest of the thoracic cavity moves inwards. Rest of the thoracic cavity moves inwards. So this is what is called as paradoxical movement. Paradoxical movement. During inspiration, this flail segment moves inwards because of the negative pressure. And during expiration, this flail segment moves away because of the positive pressure inside the thoracic cavity. So for one last time, I'll explain this. Because of this negative pressure during inspiration, this flail segment comes inside, and during expiration, because of this positive pressure, flail segment goes outside. Flail segment goes outside, exactly opposite to the normal thoracic cavity movement during inspiration and expiration. So the next important aspect for us to understand is pulmonary contusion. Pulmonary contusion. So as I've explained earlier, this flail segment moves outside during expiration and it moves inwards during inspiration, right? Because of this inward movement, during each inspiration, because of this inward movement of this flail segment, it is going to damage or injure the lung parenchyma, and this is going to cause pulmonary contusion. This is going to cause pulmonary contusion. So in this image, you can see this is during inspiration. So we have air from the atmosphere. Because of the negative pressure, it comes inside. It comes inside. So because of this negative pressure here, this part of the flail segment is moving inward. And here you can see this is expiration. Air is exiting. and here the pressure is positive. And because of this positive pressure, air is exiting. At the same way, this positive pressure is pulling this flail segment away, is pulling this flail segment away. So this is paradoxical movement. And because of this inward movement of this flail segment, it causes pulmonary contusion. So from flail chest, we understood they have pulmonary contusion and paradoxical movement. So what does it lead to? What does it lead to? It leads to lung collapse. It leads to lung collapse. So we'll take the same image. So because of this inward movement of the flail segment, this lung parenchyma gets compressed, right? This part of the lung parenchyma gets compressed. And because of this compression, this entire part goes into lung collapse. This entire part goes into lung collapse. So what happens because of lung collapse? So this is the flail segment that is going to impinge the underlying lung parenchyma, causing lung collapse. So this is the normal airway, and this is the normal alveoli, which has normal blood supply, right? In the normal airways, we have cilia, and you have mucus, cilia and mucus. Because of this action of the cilia, the mucus usually gets expelled out, right? The mucus usually gets expelled out. And in this image, you can see because of the collapse, there is stagnation of mucus. There is stagnation of mucus. Mucus is unable to get out. Number one, mucus is unable to get out. Stagnation of mucus. The second thing is air cannot enter inside and it cannot reach the alveoli. It cannot reach the alveoli because of the collapse. So second is no air. No air leads to hypoxia, right? No air leads to hypoxia. Because of the hypoxia, the surrounding blood vessel, they undergo vasoconstriction. They undergo vasoconstriction leading to reduced blood supply. Reduced blood supply. So stagnation of mucus and no aeration leads to bacterial growth. Bacterial growth. This leads to pneumonia. This leads to pneumonia. And because of the reduced blood supply, we cannot get WBCs to counteract this bacterial overgrowth. So patient ultimately is going to suffer from pneumonia, and this is going to lead to death of the patient. So lung collapse, lung collapse is deadly because it is ultimately going to cause pneumonia and death of the patient. So what is the investigation? So investigation, this is a clinical finding. Flail chest is a clinical finding. So you are going to investigate flail chest as any other rib fracture. You take chest X-ray, AP view, and HRCT is the gold standard or investigation of choice for the flail chest. So coming to the management part, so how do you manage flail cyst? So because of pain, patient is not going to breathe. Patient is not going to breathe well. And if patient doesn't breathe well, that part of the lungs is going to collapse. And because of collapse, patient is going to develop pneumonia and patient is going to die. Patient is going to die. So we have to manage pain well. So if we manage pain well, patient is going to breathe well, and we are going to prevent the collapse. Then once we prevent collapse, there is no pneumonia, patient is not going to die. So pain manage becomes very, very crucial in case of flail chest. And pain management, we have a combination of all these things, oral analgesic, IV or IM analgesic, and even we can give nerve blocks like intercostal nerve block that can help with reduction in pain. And we can also give epidural analgesia to bring down the pain, right? So some patients respond well to this pain management and they breathe well and they breathe well. In some patients, even after adequate pain management, they don't breathe well. They don't breathe well. So in these patients, you have to provide the breathing, right? You have to provide the breathing. So same concept. This breathing you are going to provide from outside in the form of intermittent positive pressure ventilation. Intermittent positive pressure ventilation. So what is the indication of this intermittent positive pressure ventilation? When respiratory rate is high, more than 30, and PaO2 is less than 60 mmHg, you go ahead with intermittent positive pressure ventilation. And some patients recover well and they breathe well. so we can avoid all the complications. So even after providing adequate analgesia and intermittent positive pressure ventilation, some patients may fail and they do not respond well. So the last resort in these patients is surgery, and this is done by rib fixation. This is done by rib fixation. So that is all you need to know about flail chest.